I'm Shaki Shireen. I'm based out of Bangalore and been in Bangalore for the last 12 years. Throughout my life, I have been very conscious about my health. I always wanted to have a good health with no problems whatsoever. So I think at least for the last 20 years, every year I have a routine checkup. In the year 2015, I had gone for my routine checkup, and there they found out that they have some epithelial cell lesions. So the doctor said that it could lead to, it could be cancerous. So recommended Dr. Rohit Ranade. I came here. So Dr. Rohit has been very good. He's guided me in many ways. Being a very good surgeon, and it's a very charming person, approachable, loving, caring. It just doesn't give service, he cares. There's always a difference between service and care. And with Dr. Ranade, you get both. And then for 2 years, he kept me under observation. He said, there's no hurry, there's no need to go for a surgery right now. We'll go have a look at you for next 2 years. So this year in 2018, again I went for my regular checkup, and then we found that it's still there. Some HPV DNA positive is still there. It is persistent. So then he just suggested me, in fact, I was to take the decision, and he said that I should go for a hysterectomy. So I did go for the hysterectomy. It was a very successful surgery because today is the 8th day after the surgery, and I'm absolutely fine. I'm moving up and down. I went up and down the staircase. I had no problem.
The cervix is basically the mouth of the uterus, and cervical cancer is one of the commonest cancers occurring in women in India, and mainly it is caused by HPV, human papillomavirus 16 and 18. Now most of the women will have the human papillomavirus getting eliminated out of their body, but this lady had it persistent for more than 3 years. So we did a couple of tests which included a pap smear and a colposcopy of the cervix. Now after this test, we gave her an option of whether a 3-monthly or a 6-monthly follow-up versus going ahead with a surgical intervention, that was a hysterectomy. She chose to undergo the surgical intervention. She underwent a robotic assisted hysterectomy with a bilateral salpingo-oophorectomy, and it was quite heartening for me as a surgeon that I went on the rounds nearly about 4 hours after the surgery, and I asked her how was the pain. She said, no, I don't have any pain. I just don't feel that I have had surgery. So I think that level of comfort is quite gratifying for me as a surgeon. Today is her 14th postoperative day. She is doing quite fine. Her histopathology report is normal. So she will just need to be on a 6-monthly to 1-year follow-up.
My one suggestion to every woman in this world, whoever is able to watch this video of mine, is please do go for an annual checkup, which is very essential because cervical cancer is dangerous and it is life-threatening. I would recommend Dr. Ranade to people who would like to come for a surgery or for a consultancy to NH. So it's not easy to recommend somebody just like that unless you're good at what you do. Narayana Health City or Mazumdar Shaw Medical Center does have people who are human in nature. If you tell me out of 10, I would give 9. There's always a scope to improve, so 1 I keep for myself. Thank you so much.